Hundreds of people across Washington state are sitting in jail waiting for mental health services from the state. The issue is that there's no space. So thanks for joining us for Fox 13 News at 10. I'm David Rose.
And I'm Jamie Tompkins. It's a problem Fox 13 News has been reporting on for months, and there is a new issue here. Fox 13 News reporter AJ Janivel explains why some patients may not get the services that judges order for them to receive. So, AJ, what are you learning tonight?
Jamie, criminal defendants whose charges are dropped due to incompetency but still need mental health services from the state are called civil conversion patients. Now, in a recent letter, the Department of Social and Health Services says state hospitals no longer have the space for all of these cases.
The state is in a crisis when it comes to mental health services for people facing criminal charges. Right now, there's an 850-person long wait list to get into beds at Department of Social and Health Services hospitals. Due to the wait, some judges are ruling the state must pay defendants who are stuck in jail awaiting competency restoration. One standout instance of this issue is the case of Alexander J. Jay's accused of going on a 12-hour violent crime spree, including a murder, back in March of 2022. A judge ordered Jay into a state bed for mental health restoration, or to start paying him $250 a day. That was since May. Jay is still sitting in jail, and taxpayers now owe him more than $60,000. He's just one of several similar cases. In total, the state paid out more than $93,000 to several other defendants. But these people ordered to state hospital beds aren't the only ones on the waiting list. Felony civil conversion patients are described as defendants whose felony charges have been dropped because they aren't able to regain their mental competency. Despite the charges dropped, these civil conversion patients are still ordered to get mental health treatment. The treatment, however, takes longer than most competency patients. In fact, about 4 to 5 times longer. That means beds are occupied for longer too. In this memo sent out to judges, defense attorneys, prosecutors, and law enforcement, DSHS explains they no longer can handle the amount of felony civil conversion patients and will have to start turning some of them away. According to the memo, this could lead to, quote, these individuals being released from jail into the community. Officials with the King County Prosecuting Attorney's Office tell me they did not get any prior warning of this change before the memo's release. They say they're unsure what criteria DSHS will go with for this change. Officials with DSHS tell me they make the decision by looking at which patients are the highest risks based on their charges, criminal history, and their current mental state.
So this change went into effect back in December. The big question is, how many cases has this affected? I am still working to get that answer. David, Jamie?